A lot of college going girls who are not married, or even working girls who are between the age of 16 years to about, let's say, 35 years, could be suffering from irregular cycles. What is the common reason for suffering from long term irregular cycles? The short term irregular cycle that, well, my cycles are irregular for the last 3 months or 6 months, could be purely because of stress, or could be because of an excess weight gain or a weight loss, or could be some scheduling difficulties which have been, or stresses experienced recently. But a long term irregular cycles, the major reason in India is the lady could be suffering from polycystic ovarian syndrome. How do you identify? So there are Barcelona 2018 conference of European Society of Human Reproduction laid down certain criteria for diagnosis of polycystic ovary syndrome. Number one is irregular cycles. Is your cycle beyond 35 days? If you're regularly getting cycles beyond 35 days, could be 40 days, 45 days, or 90 days, then this is one of the criteria of polycystic ovary, suggestive of a polycystic ovary syndrome. Second, are you high on hyperandrogens? That means, do you have some male features? In India, having a few chin hair and few upper lip hair is very common for girls. But suppose that girl has hair around the breast, around the areola, in between the breast, between the umbilicus and the chest, or she's having hair on the back of the thigh or the interscapular region on the back. That means her androgen levels are very bad. They are very, very high. There is no reason for somebody who is beyond 20 to keep suffering from acne again and again. That means her androgen or the male hormone level is fluctuating and going up and down. And these are the girls should make aware about PCOS themselves, and they should try to find out whether they're really suffering from polycystic ovary syndrome. Biochemically, when a girl comes to us with this acne and excess hair kind of pattern, we do a free testosterone level, a sex hormone binding globulin level, to know what kind of, how much is the androgen high in that particular lady, and come to reach diagnosis of polycystic ovary syndrome. The third feature is on ultrasound. But many unmarried girls will not like to do a transvaginal ultrasound. But Barcelona 2018 criteria says transvaginal ultrasound using an 8 megahertz probe is the only diagnostic criteria to know polycystic ovarian morphology on the ovary. So if your ovary can see about 20 eggs or more at one time, that means you are having a polycystic ovarian morphology, and that's the third criteria. But since we are not doing transvaginal scan for somebody who is not sexually active or not married, we are bound to do an abdominal scan. But on abdominal scan, diagnosis of polycystic ovary is difficult. And in these girls, we use a surrogate criteria for diagnosis, and that is serum anti-Mullerian hormone level, or a blood test for AMH. And if you're maintaining an AMH level beyond 5.5 and you have an irregular cycles, and you may have excess hair or you may not, then this is diagnostic of polycystic ovary. It is imperative for every girl who is suffering from irregular cycle to know whether she is PCO or not, because this is the only preventable cause of infertility. You can do a lifestyle change, you can do weight reductions, you can go on a good exercise and yoga schedule, you can take metformin, you can take some pills to regularize your cycle so that your polycystic ovary syndrome does not progress. If you're not aware about it and you don't carry a good lifestyle, by the time you come to a marriageable age and you are in a relationship, you have grown by about 10 kgs in spite of knowing that you had irregular cycles in the past. You are now spoiled your polycystic ovary. Now you have made it difficult to achieve a pregnancy, and your cycles could go more haywire, more irregular, a lot of oiliness of the skin and cosmetic problems you could suffer. So earlier you know, better. So we would advise everybody, every girl who is suffering from a long-term irregular cycle to do consult us to know whether you're really suffering from a polycystic ovary syndrome or no, and we can guide you, manage your PCOS so that your future fertility is better and cosmetically you're much better. I hope this helps you. Thank you.